Hey everybody, it's 7:59. We have like 1 minute, and then I'm going to try to get started right at 8 o'clock. Hey Ashley, hey Rochelle, how are y'all doing? Oh, we got a lot of people here. Leslie, Siobhan, Everyday Life with Taboo, Nicole and Rose. Hey y'all. Hey Deidre. Ooh, there's a lot of people today. All right, well, that's good. So that means that we're going to have some really good conversations. Hey, Erin, how are you, girl? All right, y'all, it's 8 o'clock. So let's get rolling, okay? So we're going to do an FAQ tonight because there are a lot of new faces. Since the last time that I did a live event, which was on April 22nd, we have pretty much quadrupled in size. So yes, there are a lot of people here. So hey, y'all, hey, I'm so happy that all of you are here with me and all of you have subscribed to my channel. Make sure if you haven't done so already, please say hi in the chat so that I know who's here with me, because I can't see who's here. It just shows me the viewer count. The live chat is open. I will check the chat periodically and answer a few questions throughout the night. But I do have a few questions that I consistently get either in my DMs or in the comments or in my email. So I figured I would go ahead and get those answered and get those out of the way. For some of you who have already watched some of my other live videos, some of these questions may be redundant, but the answers are a little more in detail. So my apologies for those of you who are like OGs and have been around for the other FAQs. But before we jump in, let's do a little housekeeping, okay? So, okay. And then the next thing is, I know I say this often, healthcare administration is not limited to hospital jobs or jobs that are pertaining to being a hospital executive, okay? So check out my entry-level healthcare administration video after you get done watching this live for detailed information on other healthcare administration career options and different sectors within the healthcare industry, okay? All right, so I'm gonna go and check the chat really quickly before I jump into the FAQs, okay? All right, just to say hi to y'all. So hey, Courtney. Hey, Sonia, Katina. There's a lot of new names here. Hey, hey, hey. Hey, Miss Ask the Biller. Y'all, she's a great resource if you want to get into revenue cycle management. Ask the Biller on Instagram. Oh my gosh, check her out, okay? And she can definitely answer some revenue cycle questions in the chat. So if y'all have very specific revenue cycle management questions, medical billing or coding questions, please ask the Biller and she'll be able to help throughout this FAQ while I'm trying to get through this information. All right. So let's get started. So the first question that I get very often, very often, and these aren't in any order, y'all. I just kind of like threw these questions together. So the first question is, do I need clinical experience to work in healthcare administration? The answer is no, you do not need any clinical experience to work in healthcare administration. And I don't want to be deceptive here. Yes, there are healthcare administration jobs that do require some type of clinical background, or for you to be like an LPN, a registered nurse, or even a doctor. So like utilization management nurses, nurse case manager, medical director, hospital supervisor, et cetera. Like all of those jobs require for you to be either an RN, LPN, or medical doctor, okay? But there are plenty of jobs that do not require any clinical experience, okay? All right, so quick side note here. So I did a TikTok last week, I think, or maybe a week before, covering this topic. And y'all, the nurses on TikTok and the bedside staff on TikTok, they went in on me, okay? Like they believe that administrators should have clinical experience and that's it. And I just want to say this, I have the utmost respect for nurses and bedside staff. They are literally the heartbeat of healthcare. But listen, like the way that they thought they were reading me, like an open book, straight up. If y'all go back to that video and look at some of the comments, like I'm just thankful that I was able to respond with tact, and I, at least I have some experience and knowledge behind me. But I just want to say this. So like a lot of bedside staffers think non-clinical folks should not hold management positions in clinics, medical practices, etc. And I agree with them for certain management roles, but I think what it boils down to is the lack of understanding, not just with nurses, but a lot of people who don't know that healthcare administration is complex and it reaches beyond jobs in the hospital or clinic setting. Let me know if y'all agree or disagree in the chat, because I really want to hear what my healthcare administration folks think about that. And another side note here, quality of patient care is always going to be priority, right? Remember, we are in the United States, where our healthcare system is a mix of public and private coverage. So we don't have universal healthcare, which ultimately means that healthcare is a business. So yes, healthcare does need people with a strong business acumen to run the healthcare system, to make sure that the business side of healthcare is operating and is successful. So let me know what y'all think in the comments, and I'm gonna step off of my soapbox because I really could go on and on and on, but I'm not gonna do that to y'all tonight. So before I get into the next question, I do just want to list out really quickly a few non-clinical healthcare administration career options. So one is healthcare compliance and auditing, supply chain management, healthcare finance, health information technology, revenue cycle management, project management, product management, and practice administration. Those are just a few non-clinical healthcare administration career options. So I'm gonna go into the chat and see what y'all have to say. Okay, Nicole, you're asking about like the best jobs to apply for. I'm gonna kind of touch base on that a little later. I am a graduated with my bachelor's in health administration, but I find that I will have to take a pay cut if I get an entry-level position. Well, I have some advice later that hopefully will help you out and you won't have to, necessarily take a pay cut, but we'll talk about that a little later, okay? So I see Aaron and Ashley agree. All right, so let's jump into the next question, which is, should I get a master's in business administration, a master's in health care administration, or a master's in public health, and which one is better? So I'm just going to kind of go down each of these degree options with y'all, and then, we can kind of go from there. All right. So with the MBA, an MBA is a broad and versatile business management degree. The courses taken are like accounting, finance, organizational behavior, marketing, statistics. And again, this is just going to be for general business overall. So you can transfer this general business knowledge to different industries. It doesn't have to necessarily just be in one specific industry. With the MHA, there are a lot of overlap in the courses in the MBA program, but it is focused on the business side of healthcare. So courses taken are going to be like healthcare accounting, healthcare finance, health law and ethics, health policy. But again, you're going to be taking a lot of the same courses that you're going to take in the MBA, except for it's going to be focused on healthcare administration. And then the Master of Public Health, that degree focuses on promoting community awareness about infectious diseases, injury, illness, and other issues that affect health and safety. Courses that you would take would be like biostatistics, environmental health, health promotion, and communications. So the next question is, which is better? I can't necessarily tell you which degree is better because it really depends on what career path you're interested in. I can only share my experience of having a dual master's in business administration and health administration. And having both degrees has definitely given me the capacity to see like a broad view of the entire medical industry. It has also sharpened like my core business skills in finance, accounting, operations, like information systems, management. And then it also shows me showed me how interconnected all of these skills are amongst different industries. So with having the MHA and MBA, I feel confident that if I wanted to get out of healthcare administration, I would be able to walk into a leadership position in any industry and still have a really good understanding of how the core business works. Does that make sense? Somebody let me know in the comments if you have any specific questions about the MBA, MHA, or the Master's in Public Health, and if my explanation of having a dual MBA, MHA makes sense, I guess. So while I wait for y'all to tell me, if you have any questions about the graduate degrees and if it makes sense what I said about the dual MBA, MHA, I just want to share this with y'all. Like, we know that a degree is almost always required to advance in a career in healthcare administration. And we all know that education in the United States is not cheap. So because of this, I partnered with Juno to help you figure out how you're going to pay for your education if you are like millions of Americans who either have student loan debt or who are going back to school to pursue an education and will have student loan debt. So thank you so much to Juno for sponsoring this portion of today's live FAQ with me. Juno offers the most affordable private student loans and student loan refinancing. So check out the link in the description box to learn more about Juno. All right, let me jump back into the live chat. To be me. Any suggestions on certificates that we should get? I live in Los Angeles and it is very competitive. How do we set ourselves apart from others? So healthcare administration, the field is vast. So there's so many different directions you can go in. So it really depends on that direction. So if you want to be a medical biller and coder, then I would suggest that you try to become a certified professional coder. If you wanted to become a practice administrator, then, I would suggest definitely like a degree in business, or MGMA has, I can't think of it off the top of my head, but they do have like a certification for practice administrators. I can't think of the acronym exactly, but I'll add it to the comments. Well, I'll reply to your comment after I post this video. Let's see. Do you feel the graduate degree is needed to continue to climb the ladder and not get stagnant? Rose, I don't know. I don't. It's hard for me to answer that question because I work with people who have a bachelor's degree and they don't necessarily have like a graduate degree, and they have like 15 years of experience in the field, and so that helps them. And then I also work with people who have, graduate degrees with only a few years experience. So I don't know. I think sometimes experience trumps education. All right, I'm going to answer 2 more chat questions and then get back. When I began working authorization 6 years ago, a lot of nurses and physicians gave negative feedback for us who were not licensed nurses. So Deidre, you were working in like utilization management. Were you working for an insurance company or for a hospital? And what type of negative feedback did they give? Help me understand that. All right, I'm going to hop back into the FAQs, guys. All right, so here's one question that I get a lot. The CAHME accreditation. So that's the Commission on Accreditation of Healthcare Management Education, or CAHME. So the purpose of accreditation is to increase the quality of education offered at the college level. Schools that have been properly accredited must participate in a stringent screening process that ensures all quality standards are being met or exceeded. Programs are not required to obtain accreditation. It is 100% optional, y'all. However, accreditation is important for employers because they will verify if a program is accredited, which tells them that an outside authority ensures the program meets the high standards of quality. Okay, so here's the thing. The graduate school that I went to is accredited by the Accreditation Council for Business Schools and Programs, or ACBSP. Both CAHME and ACBSP are recognized by the Council for Higher Education Accreditation. So I say all of that to say this. Last year, I was extended 2 director level positions for nationally recognized healthcare organizations, and neither of them asked me during my interview process or even when they extended me the job offers if my MHA was from a CAHME accredited program or if my MBA was from an AACSB program. I currently work for a large health insurance company. Many of you know that. And during my interview process, no one asked me about the accreditation at all whatsoever. So my experience with accreditation, for me, I don't think it personally matters that much as long as the school is accredited. However, that's just me and my experience. So my advice to anyone who is, concerned about going to a school that is only CAHME accredited, do your research. Just do your research. And figure out what's best for you. All right, let's do one more FAQ before I hop back into the chat. All right, so another question, actually, these 2 questions I get the most out of any of the questions that I get. And this is, and they are, which career should I choose and where should I start after I finish school? Okay, so I can't necessarily tell you which career to choose or where you should start after school. What I'm here to do is just give you as much information as I possibly can. And then, I will ask questions like, what are your interests? Do you like data analysis? Do you like working with numbers? If so, maybe start researching like analyst positions within health insurance companies, hospitals, medical practices, biotech companies. Of course, I'll ask other, questions just to try to figure out exactly what you're interested in to help kind of nudge you in the direction of researching a career field or path that you may be happy in. I can't just say, hey, go get a job, I don't know, at an insurance company, because you may find that you don't necessarily like that culture there or what an insurance company stands for. You may find that you might want to work in a hospital setting, So what I'm here to do is just give you as much information as possible and try to give you the knowledge so that you can make informed decisions on which direction you want to take your career in. All right, I'm going to go back to the chat before I get into the next question. I'm going to scroll up a little bit here, guys. I think I went back too far. Hold on, I was all the way at the beginning. How do you feel about a lateral career move if I feel stagnant in my current role? Sometimes you have to do that, Tiffany. Sometimes you have to have a lateral career move in order to move forward, especially if you're going to move into an organization that is going to have more opportunities for career growth and moving up. So I don't think there's anything wrong with a lateral career move, especially if you're going into an organization that has more opportunities for you to grow. All right, I'm going to hop back into the questions, y'all. All right, so another question that I get often is, how do I transition into a career in healthcare administration, or how do I get my foot in the door? So I know I've said this in other videos, but leverage your transferable skills, okay? So if you've never worked in healthcare administration before, you may not have any work-specific skills, but I am certain you have skills that can transfer from whichever field you're in into healthcare administration. So maybe you have data analysis skills, but you've never used your data analysis skills in a healthcare administration setting, but you can highlight those skills and demonstrate how your transferable skills correlate with the job you are seeking. Okay. And then also, whenever you are applying for these jobs, I know y'all get tired of hearing me say this, but customize your resume for each position that you are applying to, because a lot of companies use applicant tracking systems that focus on keywords, okay? And then I also want y'all to highlight your accomplishments and the quantifiable outcome instead of just listing your responsibilities. So for example, let's say on your resume you have managed a staff of 10 people. Well, okay. Like, that doesn't tell the recruiter or the hiring manager anything. That's just telling them that you manage 10 people. They don't know if that's a good thing or a bad thing, right? Like, would y'all agree with that? So instead, I want y'all to say something like, manage a team of 10 customer service representatives. I motivated, guided, and trained my team to quickly and efficiently resolve the customer's issues while maintaining a positive disposition, which increased customer satisfaction survey scores by 20% month over month. So you see, like, you're highlighting what you're capable of doing, how you were able to do it, and then you added on like something that was quantifiable and measurable to tell the hiring manager or the recruiter the effort and time that you put in and the tools and skills that you use to have a successful result. So does that make sense, y'all? Like, instead of just listing like, I managed people or I did data analysis, like actually talk about like what you did, and then make sure that you're adding in something that's measurable and quantifiable. All right. So before I get into the last question, I'm going to jump into the chat again. Let's see. Tiffany says, what is your opinion on doing an MHA online versus in person? I don't really have an opinion on it, except for I did my MBA and MHA, like all of my education in person, because I get distracted easily. And if I was doing it online, I would not learn anything. So I had to do schooling in person. But I don't necessarily think there's a difference if you're focused and you are able to retain the information and you're disciplined enough to do it online. I don't necessarily think there is a difference. All right, let's see. What are the best options to get into? Antoinette, I'm not 100% sure about that. So Antoinette said, recently graduated with my associates. What are the best options to get into performance improvement? Currently work as a medical assistant in a hospital. I'm not 100% sure. So I'll have to get back with you on that. Okay. Oh, Sonia made a really good point. When you go to school in person, you can socially network more than online. And Sonia, that's exactly what I'm going to talk about next. Networking. Networking is so important. So I need y'all to create a LinkedIn profile, connect with people who are in the field that you're interested in. You can also connect with people on social media. That's how a lot of y'all found me, social media. Join professional groups. There are a lot of professional groups that have discounted student memberships and early careerist memberships. So groups like Medical Group Management Association, or MGMA, the National Association of Healthcare Access Management, the Association for Healthcare Administrative Professionals, and the list literally goes on and on. But look into those professional groups. And if you already work in healthcare administration, sometimes you can get your employer to pay for your membership. So don't be afraid to ask your employer, especially if you've talked with your supervisor or manager about wanting to grow in your career, you can definitely present this to them and say, hey, I want to grow in my career. I would love to be a member of MGMA. Can the company please pay for my membership for X amount of years? And look, you don't have to pay anything out of pocket. And now you have all of these networking opportunities to people in the field. Another thing that you can do to network is attend networking events. And I say this, y'all, I hate networking events. I get like social anxiety, but attending these events and meeting people is so important, especially when you're trying to get your foot in the door. And then the thing is, like, you never know who people know, and that's a lot of times, like, our opportunities are connected to people. And so if you get out there, you put yourself out there, you meet people, you may be, talking to the person who's going to offer you that, mid-level or leadership role in healthcare administration. All right. So y'all, those were all of my FAQs. So what I'm going to do is spend a few minutes in the chat. So let's see. With UR to get approval of radiology, oncology, surgery procedures approved. They didn't feel we were knowledgeable enough, even though I have a medical background. Deidre, it sounds like there were specific things that happened that probably made them feel that way. That's what I'm thinking, because I know a lot of people who work in, authorizations or scheduling, or even in utilization management that don't have a medical background at all. The introvert in me felt triggered. The anxiety is real. How do you approach someone? Rose, girl, so I went to a networking event last week. And it was just like a general professional event. Like, it wasn't healthcare administrators. And I'm typically accustomed to just going to like networking events for healthcare administrators. So I had to figure out my whole spiel, and just build up enough courage to just walk up to somebody and say, hey, how are you? I'm Courtney Hunter, look them in the eyes and shake their hand, and then ask them hey, so what do you do? And that's what I do. I don't know if that's the best thing to do, but that's what I did last week. And I got quite a few, I made quite a few connections. Hey, Candace. All right, let's see. Belladina, I'm currently in school now working towards my bachelor's in HSA. What tips and tricks can you provide to help me prepare? Belladina, it really depends on the field or career that you want. So I highly suggest that you check out my video. I think the title is 7 entry-level healthcare administration positions. And that'll just kind of give you an idea of all of the different career opportunities and options within healthcare administration to help you figure out which route you may want to take. Do you hold any specialized certs? Would you recommend them to boost application? I don't have any certifications. And would I recommend them to boost applications without management or supervisor experience? Again, it really depends on which career option you want. So just to kind of do a quick recap, you have healthcare compliance and auditing, supply chain management, healthcare finance, health information technology, revenue cycle management, project management, product management, practice administration, and the list literally goes on and on. So do some research and watch my other videos that talk about some of these career fields. And the video that I will be uploading next week will talk about revenue cycle management. And it's actually going to end up being a 3-part video because revenue cycle management is very complex. So, watch those videos, get more information about the different career options in healthcare administration. And then, I think from there, a lot of you who ask me, what should you do to prepare to get into the healthcare administration field after graduation? It'll help you, once you have that information, it'll help you be able to ask more pointed questions. So you could say things like, okay, I want to work in revenue cycle management. Where should I start? Or I want to work in product management. Where should I start? Because then I would be able to help give you a little more guidance. But when you say, I just want to work in healthcare administration, it's hard for me to help give any good advice. Does that make sense, y'all? All right, I'm going to take 2 more questions. Let's see. Do you have a video on the career path to practice administration or project management? I do not, but I can definitely add that to my list. Those are great suggestions. Yeah, I'll definitely add those 2 career options to my list of careers to cover. All right, I know I said I was only going to take 2 more, but I'm going to keep going because y'all are still asking questions. Let's see. Sonia says, do you have to be good at math to have a career in healthcare administration? So again, healthcare administration is so vast. So a product manager isn't necessarily going to be doing as much data analysis as a director of revenue cycle management, or someone in health information technology isn't going to be doing as much math, if you will, as someone who's in healthcare finance. So it really just depends on the career option. Can I use my degree? Yeah, you can use your degree anywhere. All right. There aren't any more comments in the chat. So I'm going to go ahead and end this live chat. I'm sorry, this live stream, y'all. For all of you who are trying to get into healthcare administration, please don't give up on your job search. Keep customizing your resume, keep applying to those jobs, keep networking, keep pushing. I promise your time is coming. Ebony, that question about like how to like search for jobs on LinkedIn, that kind of is clicking in my head now, and I think I may want to do a little research on that. And what I'll do, like once I get some more information, I'll post it in the community board on what I come up with, and then, we can go from there. Again, I was trying not to be too redundant in this video, but if your questions weren't answered in this video, they are most likely answered in one of the other live Q&As that I did. And the link to both of those videos will be down below in the description. All right. Thank y'all so much. It was nice to meet all of the new people. I'm so appreciative and grateful and thankful for all of you. And I will see y'all in my next video. Peace.